Welcome to the Deep Six podcast, where we make a generational impact on you and yours. What we do here is explore a 6-point model into your health, your life, and your journey while you're here. So let's dive deep and help you thrive, not just survive. So welcome again to the Deep Six podcast. This is Dr. Lewerenz here from Longevity Health Institute, welcoming a good friend and one of my mentors, and actually somebody that's laid a lot of foundation for me. I want to give you credit for that. A lot of years ago when I had hair,
Yeah.
But Sahar Swidan, PharmD, and thank you for joining us. I truly appreciate it out of your busy time. So I got to introduce you though.
Absolutely. So happy to be
And this is really like, I don't know if you want me to go on this long, but you're a pharmacist, a PharmD, and you're a fellow, you're, a lecturer globally, internationally, right? But giving you a little background and for the audience here, the impact you have on physicians like me in the longevity space and preventative space and holistic functional medicine space is huge. So thank you. And we'll get into that and also get on a lot of sidetracks. But let me just share the audience just a little bit of a few things. One is obviously you're a PharmD. You're from Ann Arbor. You still live in Ann Arbor?
Yeah.
You do? Wow. Okay. And you're an associate clinical professor of research and leadership at George Washington University School of Medicine and Health Sciences. You're an adjunct clinical associate professor of pharmacy at Wayne State University. And you hold, I think, a few, right, medical advisory boards, right, positions. And tell me if I'm wrong here, but one of your biggest positions is through A4M, right?
Yes.
And what do you kind of do there? What's for the like?
Yeah. So, A4M is the American Academy of Anti-Aging and Regenerative Medicine. It's really the global leader in this type of longevity education. And so I was always just so grateful and privileged to be part of that organization for the past, totally aging myself now, for the past 28 years. And really in the past 5 years, I've been in a different role with, the Director of Professional Education and Development. So working with amazing faculty that we have at A4M, curriculizing a lot of our fellowship program and some of the additional educational offerings that we provide in the United States and really throughout the globe. Yeah. So always, that was always, I tease my crack. I love teaching. I love gabbing. And I get to meet amazing people like Dr. Lewerenz many moons ago. Now I think we've known each other couple decades at least now, at least.
Yeah. Like I said, I had hair and probably moving faster and, probably less kids. And,
exactly. So, we get to meet and it's so fulfilling because, I have the pleasure of teaching a lot of, the healthcare providers, and then they go out and touch thousands and millions of life. And that's always been really my love and passion, is teaching this kind of medicine. And I always called it when East and West medicine meet, really real magic happens when we really kind of combine our allopathic training of all the good stuff that we learned in med school, pharmacy school, nursing school, dental school, whatever, our allopathic training. And then when you you kind of combine the other integrative functional medicine, longevity medicine modalities, now we really can take the patient so much further. And really the goal here is increasing health span, not just quantity of life or lifespan, but health span. Nobody wants to live to 100, but be demented, decrepit, and can't do anything, right? What kind of quality is that? So I think in this kind of medicine, we're really trying to teach a lot of the healthcare providers these additional tools and modalities where we can really have patients, like you said, thriving versus surviving.
Correct, yeah.
But, really, give them the best quality and to be the best version of themselves for as long as possible.
Right, exactly. No, I love it. And that was, I'm going to ask you your paradigm shift in pharmacy. Mine was, and it was, close to a couple decades ago, in a space of just regular medicine. And a lot of the audience know this already, but because I've speak of it often, but where it didn't resonate with me, but I actually started to feel it myself, and I was band-aiding things. And when you take like the space that you're in, where you're laying a foundation educationally for so many physicians and practitioners, you're looking at the root causes of things, and you're looking at the functionality. And what was so a paradigm shift for me was like, wait a second, we don't just have to band-aid, we can actually get better and thrive. And like you said, work on health span and it's so powerful and impactful. That's what's so exciting, is because every day today, I mean, not ego or anything like that, but today I know I saved a life with something we found, a cardiac, a bad CTA, and, long story short. And how do we pick up a CTA? We picked it up on a in-office autonomic test that we did, and some labs that I just had suspicion. This is the kind of guy that drops dead or has an event on a treadmill.
Yeah.
So anyway, so what was your paradigm shift? What was your, like, you were in school, and you were starting your early career. What kind of shifted a bit for you?
Yeah, so it was kind of an interesting journey, because I always, tease, like you said. So I always say we were all trained really for Band-Aid medicine in our schooling. Symptom drug, symptom surgery, right? I mean, that's really how we're all trained, right? So I always called it Band-Aid medicine, where I love root cause medicine. So all through my schooling, I was always the why child since I was born. I drove my parents crazy. I started reading at 3 years of age, so I started to read very early on, and then I was always, but why? Like something didn't make sense. I had
a brother like that. By the way, my dad would reach in the back of the seat trying to choke him out. He's driving.
So, and then, because it was always like I had to understand the logic, the root cause. Well, but why? And it's really when you ask the why that gives us a deeper understanding of just everything in life, not just, medicine. So my paradigm shift actually, so I was studying, I obtained my Doctor of Pharmacy degree from, that big M school over here, University of Michigan. And
my undergrad.
So, so then I wanted to do a postdoc fellowship. And long story, I was going to med school, but I kind of tore that up. So I teased they drugged me, and then I ended up in pharmacy school. So, and then my postdoctoral fellowship preceptor, she fell in love with a Frenchman, of all things. So here I am, a 20-year-old punk, started school a little early, another long story. So, 20-year-old punk, I come out and I have all these clinical trials. We had these, grants and things. And I was like, okay, this is a little intimidating for a 20-year-old. I just got off the boat, right? Just got off schooling. And she fell in love with a Frenchman. So because of that, I had to go to Europe a lot to run, and kind of do statistical analysis and study design and all the stuff that she had these grants for. And then when I went to Europe, it was like, wow, they do whole body medicine there, right? So I would go to the pharmacy, and they had all these supplements and vitamins that we learned nothing about, very little, right?
Apothecaries.
Exactly. You go, like, they had the stuff, the pharmacist would prescribe all these, like they were like quote unquote drugs there. And then I started to dig deep into like their medical system, and like in how they really truly do whole body, mind, body, spirit, then I would go to their checkout counters, their grocery stores, and they had something called Yakult. And it was like, mind you, this is 28 years ago now. I'm totally aging myself. I was like, probiotic? What's a probiotic, right? We didn't learn anything about that.
Oh, for sure, yeah.
So then I started researching probiotics, gut health, the connection. So then when I was doing my postdoc fellowship, it was in biopharmaceutics and gastroenterology. So then I'm like, gut, microbiome, probiotics, started digging deep, looking at the gut-brain connection. It's like, wow, we did not learn this anywhere. So then when I started my clinical rotations, rounding on the units with the docs and stuff, so I started ordering these probiotics, and it was funny. This is hilarious. So my attending comes and he's like, Sahar, what is all this shit you're putting everybody on? I don't know if we can say that word.
You're good. No, you're good.
And then I said,
we won't edit that, I promise.
Yeah, no, it was like, and I was like, well, it's actually shit that makes your shit better,
Hey, it all boils down to shit in life, and in health.
Yeah, exactly. So it was like, and then of course I was using it on migraine patients. So, we had migraine patients, a lot of gut. And then the data started coming out. Oh, probiotics help, nausea and vomiting with migraines, the gut-brain connection, neuroinflammation, right? This is my world. I was always teaching pain management, neurology, and migraines. Yeah. And then, of course, way back in the day, I kind of, we came across the A4M, right? And I was like, oh my God, they're beginning to teach this kind of, again, I always loved East and West medicine. And then as soon as I got exposed to the European system, I came back here and started teaching like this. I've always been in high-level academia. I taught at the University of Michigan forever, George Washington. So high-level academics, Wayne State, right? So I was always teaching East and West. And of course, back in the day, like, why are you teaching this woo-woo wacko stuff? You're at these prestigious institutes. You shouldn't be here. They wanted to, like, throw spitballs at me and kick me out and stuff. But, now I'm finally smart and progressive, right? Finally have arrived.
Well, I'm going to say they caught up to you.
Yeah, exactly. Yeah. So, for the past 28 years. So that was really, thank God, right? I always say, like, life takes you on these weird journeys for a reason, right? Like, I was going to med school. I was accepted in med school. Ripped that application, the acceptance. They drugged me and I went to pharmacy school, ITs. And then my preceptor fell in love with a Frenchman, so I got exposed to the European medical system. Exactly, right? Yeah. And then,
but there was a purpose.
But then there was a purpose, right? Then it's like, oh my God, I found my life mission and purpose. It's like to really teach whole body systems biology approach, and I've always loved teaching. That was always my passion. So I've did tons of clinical trials, research, publications, books, book chapters, you name it, because they're just different forms of education. So thank God my paradigm shift, I guess, occurred really early on in my career. And as you know, way back, I was teaching this world, East and West medicine and, total body approach, systems biology, and how to connect the dots. I've always had a really great knack for kind of taking all this random facts before AI, as I call it. I was kind of a walking AI. Actually, my attending he used to call me, where's my Kodak Hector? Because I had a photographic memory. Always when it was like, where's my Kodak Hector? Bring her over.
Bring her over.
Yeah, exactly. It was always like, Sahar, what about this? I know you'll know this. Yeah. So I've always had this knack of like just really taking a lot of data and kind of just connecting the dots and then figuring out what's wrong with that patient and like really quickly. But I think this kind of root medicine that we do, you kind of train your brain to do that because we're not just band-aiding. We're always like, well, why do they have heart disease? Why do they have inflammation? Why do they have autoimmune disease? Versus, yes, I can give you steroids and I can give you statins and I can give you whatever, but let's see if we can figure out the why, modify whatever we can. And don't get me wrong, drugs are great. Surgery is great. Like, that's what sometimes people need to understand. Sometimes, some of our colleagues that are like, I don't want nothing to do with that.
Anything,
and that's not
I only
true.
want natural. Right.
Yeah.
Which
you can't do that. We have to go nuclear sometimes as ITs. We need drugs. Right. We need surgery. We need all this amazing technology that we have in modern medicine now. So again, the best outcomes and the magic really happens is when we marry the two together.
For sure. Absolutely. Yeah. And you being married to like your questions and not answers. Yeah. I love that because I say that all the time is that's how we continue to progress.
Yeah.
And like what we like here, your probiotics, you're so ahead of the curve back in the day as you have taught me and, other practitioners. It allows us to be open-minded and to look at the science, look at the studies, and then get a result at the root issue. And that's what really is progressive. In fact, one of my this is a great segue is one of my things I always start on the podcast is I start with a quote and just try to get your perspective on it. We're already there, by the way.
Yeah.
It's always begin with the end in mind.
Yeah.
And that's life in general, I feel. But it's also like if you do that in health, you're going to look at root issues and you're going to look at like, hey, where do I want to be, in prevention? Where do I want to be in 20, 30, 40 years?
How do you want your 50s, 60s, 70s, and 80s and 90s to look like? I always tell patients. Yeah. And you really have to start that in your 20s, at least. Yeah. And now, unfortunately, because of the toxins, the environments, the stress that everybody's on, the food system, the grossness in just in our world nowadays as ITs.
How we live,
we're seeing skyrocketing levels of diabetes in pediatrics. We're seeing heart disease in pediatrics and stuff. So, we really actually now, and they say, when should you start, healthy medicine, let's call it, or preventative medicine. It's really at preconception. Now the moms are so toxic, right? Their bodies are full of laden of toxic. The average baby now is born, and this was in 2010 study. The average kid, I think, was born with 214 toxins in their body. And that was 15 years ago in the umbilical cord, right? Blood. But now I think some recent studies that are estimating 400 to 500 toxins in the newborn.
Yeah, right.
So really, where do we start preventive medicine? Right. It's really at preconception, right?
Preconception in utero.
Yeah, in utero. Like the mom, I think, has to go like on a detox, if you will,
for sure,
of whatever for a year, even before getting pregnant now, and...
well, that would be a wonderful, preventative approach.
Yes.
Absolutely.
To really start...
Just in building
at
gut
least
and diet.
To start that child on the right track, right? Because they're kind of like... We're already in the negative, if you will, in some ways, because this child is just born, this born baby is already like in the negative, if you will, that have all these toxins that cause inflammation, oxidative damage, and all that stuff. So, and that's why I think like, we should collaborate and elevate, as I always say, East and West medicine, really we should collaborate and elevate more and always ask why. Don't Band-Aid things. Always get to the why. If you can fix it, fix it. And if you can't, let's marry East and West and use the best of both tools to really give the patient the best chance of living their best version of themselves and increasing their health span.
No, yeah, absolutely. Love it. Thank you. That's great. That's what we preach at Longevity Health Institute and what we talk about here on the podcast. So no, that's awesome. I want to make sure that I ask you these things because they're kind of like your sweet spot. I mean, who do I call when things are really complicated or I can't figure out? And I'm like, what's new? Where's the studies on this? And what should I do? Especially like during COVID, early times of COVID, it was like we didn't call it long COVID and all that, but I was picking up the phone and you're like trying to help me out through some difficult patients and that. So thank you. Yeah. But the one thing though that I want to make sure is I know your kind of sweet spot of your specialty and starting, again, what decade and a half ago or 2 decades ago was stuff with hormone replacement, bioidentical hormone replacement and migraine management and pain management. And can you kind of explain that a bit where kind of how that started, but also like where that is and going?
Yeah, so I had to become a hormone expert, not by choice, but by force. And mainly because, I did a lot of pain management, migraine, really specifically more migraine and headaches and neurology type stuff. So, in neurology, we have a lot of what's called catamenial migraine, catamenial seizures, catamenial asthma attacks, right? So, catamenial means hormone related, right? So, here I am again, I'm seeing all this catamenial stuff and I'm like, wow, I think we were taught maybe 2 hours on hormones. And I'm thinking in my brain, I'm like, boy, those suckers must be really important because they're causing a lot of havoc in body systems at certain times of the month. So I kind of huddled down, dug really deep into hormone replacement, read all of Spirov's Guyton's textbooks of medical physiology, all the hormone data that I can see because I'm like, okay, what do they do? What are these hormones doing? What is the orchestra? How do they talk to each other? Because really hormones are messengers. Every single cell in your body uses hormones. And hormones are multifactorial in the sense, or, it's a symphony. So we have the sex hormones, right? Like the testosterone, estrogen, and progesterone in men and women. So, everybody thinks men only have testosterone and women only have estrogen, which is not true.
Right.
So they have all the same hormones.
I still get looks, by the way, when I talk about, usually it's about a 60, 65-year-old guy when he's sitting with his wife. And I'm like, well, you're to her, I'm saying like, well, your testosterone looks pretty low and definitely not therapeutic. I don't think it's even touching your receptors and it'll help you in so many ways. And he's looking at me. By the way, he's not the patient at the time. He's looking at me, and I'm like, don't worry, she's not going to grow a beard.
Yeah, exactly.
You're going to be happy. Her libido is going to go up, and she's going to smile and be happy.
Yeah. And it's ratios, right? So men and women have the same hormones, but it's ratios. But also, it's really the whole symphony. It's also what we call the hypothalamus. It's these conductors of the orchestra that kind of tell your thyroid to make thyroid, or your adrenals and what we call the HPA axis, the stress, the fight or flight response.
Which we're all in.
Insulin and sugar, right? So, oxytocin, the happy, cuddly hormone. So they are really, it's a very complicated symphony. And so, like I said, I had to become
I find
a hormone.
fun.
Well, absolutely.
In playing with. What I mean
exactly.
is, meaning you're going to test, and obviously salivary, urinary, laboratory, of course, serum and stuff. But often we get people good, and then I call it fun because I can tell we can tweak some things, and all of a sudden it's like
magic happens.
Exactly.
Right?
I mean, people I've literally 30 years.
Yeah.
They've suffered from, like, whether you said migraines or even like, very low to no orgasm, or just always fatigued, or you name it.
Just tired, right? They don't have the pep in their step.
Exactly,
I call
and all of a
right?
sudden they're like, I have never felt better.
Yeah,
and it's a
magical,
wonderful, beautiful thing, and how that impacts even the household. And their life, their family,
Absolutely. Yeah, so, I had to become a hormone expert. And definitely, sometimes it was life-changing for these things, or like in our migraine patients, when we could control what's going on and kind of, the pulleys and the levers and kind of balance them out, their migraines dramatically improved, their energy, they got the pep in their step, seizures were under better control, asthma attacks. So they control a lot of things. So that's very important. And I think hormones are making a huge comeback now, huge splashes in the literature, because, with the Women Health Initiative trial 25-ish year ago now, it kind of vilified all hormones, right? So we have really 2 decades of generation of women that were really robbed of the beneficial effects of hormones.
And even put into a fear mode.
Absolutely.
Like even if that word was brought up, I still have to explain it.
Yeah.
It's like, I can't do hormones. I've been told.
Yeah, exactly. So, we have about 25 year of all these women that were robbed, honestly, of the beneficial effects of hormones. And again, we're not trying to make these people fertile myrtles at 70 as ITs. What hormones do, they kind of maintain memory, mobility, and function, right? Because they are cellular messengers. So, and they've been shown now, study after study, that they really maintain memory. They're good for bone protection, brain protection, heart protection, and, the hot flashes. So, everybody gets the annoying hot flashes, but did you know, the more severe, the more frequent vasomotor symptoms, or hot flashes, what we call, they increase your risk of cardiovascular disease or heart disease, right? Mm-hmm. So it's very important to control these annoying symptoms of menopause or perimenopause, because they really can increase your risk of heart disease. And these hormones have so many protective effects that, some of the studies, you don't want to replace them too early either, because you don't want to shut off the body's own production of hormones. If there's issues, you want to figure out why is a 20-year-old not making enough testosterone. You don't give them testosterone at 20 years of age, which drives me crazy when I see that, Or, a 25-year-old female on hormones. They're too young for that. You want to figure out why is their system and the loops are not working
Which,
first.
since you're bringing this up, often I find, which is so common, it's just the HPA axis. It's the stress response.
Exactly.
We're all in stress. It's just that's the norm now. So a lot of people just think, I'm not that stressed. And then we start talking about their life. And you're not stressed just because you're making money or you're having fun. There's no off or balance. You're just go. Yeah.
Exactly.
And it's such the norm now. Yeah.
So it's very important to always not start them early, figure out the why, fix it. But when they need it and they're truly low on these hormones, they're life-changing. I mean, testosterone, now we had the Traverse trial that was recently published that showed, that how testosterone, which we always knew in men, is very protective and very heart protective. Testosterone, very protective for men, for their brain protection, heart protection, bone protection, but also estrogen sometimes in men. Everybody wants to drive estrogen to zero in men, and that's not good either, because they need estrogen for bone, brain, and health protection.
And what I noticed is in men, because I'll have them come from another practice, they're on anastazole blocking estrogen to nothing, and they get hypertensive. Their endothelium isn't as stretchy, I say.
Exactly.
You got to get a little estrogen. You need 20, 30,
levels, right?
Per deciliter that is giving you that ability to have some vascular flow that's normal.
Exactly.
You know what I mean? So there's another study, and I can't recall which journal that just came out, but it was, to me, it's I share with everybody, is brain volume in hormone replacement individuals, actually over 2 decades, and they compared on hormone replacement, not on hormone replacement. And to me, that just is such a influence and going to be going forward too into like preventing dementia down the road the next few decades and stuff, because all of a sudden we're not going to be in this fear mode of, don't use your hormones. Don't.
Well, as you know, it's a little bit debated, right, with hormones. Oh, did they increase dementia or decrease dementia, right? There's a big debate about that. And I'm like, okay, how can that worsen or contribute to dementia? We know that estrogens work on something called brain-derived growth neurotrophic factors in the brain, which is basically this kind of thing that makes your brain plumper and bigger.
Right.
So, brain-derived
better
neurotrophic, right? We grow things when it's a
right.
trophic, something. And exactly, we increase the synapses. So the highways work better in the brain, the synaptic, connections, all this stuff. So I'm like, there's no way they could be bad for cognition, of course. And then this study comes out where it shows, your brain volume is like, I can't remember the exact number, wasn't it like 20 or 30% higher. Or, So when you have bigger brain, nice brain, no crevices in it, all that good stuff that we look for, a nice, healthy, full brain, you're going to be undemented for much longer. You're going to have no brain fog. You're going to be sharp. The synapses, the neuroplasticity, even learning new things. Yeah. That's why I always, tell people, always learn something new, because that keeps, the brain connections going. That's why piano's so good, right? Because you're using both sides of your brain. Anything, brush your teeth. If you're right-handed, brush your teeth with your left hand. If you're left-handed, brush it with the right hand. Button your shirts with the other non-dominant hands. That really just keeps kind of both hemispheres jigging and talking to each other, which always increases neuroplasticity and connection. So these are great things. Always learn something new.
Are great tools.
Yeah. Always learn something new,
And we're
puzzles,
older, we don't like to.
Read,
we don't
whatever.
Want to. So that's really good.
Hit the golf ball with the other, with the other hand, as I always say, whatever. Like, always just do something new, because that really grows the brain in different ways. Exercise, different things. How do you prevent bones, bone loss, or, osteoporosis, or what we call osteopenia? And everyone's like, hormones. But absolutely, hormones is one of the pillars. You need, like, muscles, so things that build muscle. You need good ingredients to bake the cake. So you need good supplements and vitamins, or eat it, eat your vitamins and supplements. Sometimes these bone building drugs that we use, which again, not bad, but the problem is, if you give these drugs and you're malnourished, if you will, or nutritionally deficient in the ingredients that make good bone, like calcium, and it's not the chalk calcium. It's not calcium carbonate or, citrate. You need like hydroxyapatite, right? So you need like, it's kind of like crumbled bone, if you will. It's a special kind of calcium, right? We need magnesium. We need boron. We need strontium. So that's how we build good bones. Even if you're on drugs, you should be taking these good supplements or eating them, because that's how you're going to build a good bone with the drug, on board. So, the hormones, the exercise, lowering stress, lowering inflammation. This is probably the number one thing that everybody ignores for disease. I tease now. I say we only have one medical specialty in medicine. It's called inflammatology, right?
Yeah.
I mean, literally. Heart disease is inflammation. Bone loss is inflammation. Cancer is inflammation. Neurodegenerative disorders is inflammation. Osteoarthritis and autoimmune is inflammation, right? So when you're inflamed, you're going to break down bone much faster, because you're kind of more acidic and inflamed. So, when people go on an anti-inflammatory diet, fix their guts, seal the holes if they have a leaky gut, what we call, or a permeable gut syndrome.
And I love your comments on this. I tell people, because we'll run a high sensitivity CRP, and it might be normal. And this is hypothetically a 50-year-old. And I'll say, well, great. That's a great data point. But I'm going to make a lot of assumptions that your CRP is not that all the time, and you have some inflammation going on. If you have anything gut-wise, or if you have low testosterone, or you have a low adrenal function because they're so anti-inflammatory, and your diet's related and stuff like that. So is it this is a question, is it good to assume that most of us have some intermittent, if you will, inflammation that we always need to work on?
Yeah, and also, please don't take comfort that your HSCRP is normal.
Right, that's good.
In the sense, because the immune system, there's so many things. If you really want to take a full look at inflammation, we have so many other markers that we should get. SED rates, complement system, interleukin system, cytokines, right? So a lot of time people I actually like just measuring the big CRPs, I call it, not the HSCRP, because you clock more inflammation that way.
True, that's a good point.
Yeah.
Yes.
So a lot of people do that because, that one is more the heart specific, if you will.
Yeah.
So if you get the normal CRP, they always shoot up.
Right.
But other things. But absolutely, nobody can escape inflammation in this day and age because we're bathing in soup of toxins all day long. We're breathing it, we're eating it, we're swimming in it. From the average female slaps 150 chemicals a day on her body. And that's from, cleaning supplies to beauty aids to makeup to skin moisturizer, skincare, things like that. Now, men are exposed to toxins too. It's just they tend not to put as much stuff on their bodies and face, right?
We don't mind stinking and looking ugly.
So,
even my wife's like, you start to look like a barnacle.
Yeah,
and I'm like, well, that's what we do.
So, they'll use a shampoo and that's about it. A deodorant
once
maybe.
In a while.
And, exactly. And, they're washing the dishes here and there and stuff. But, women definitely are putting more toxins and more exposed to this stuff. So, when you have toxins, you have inflammation,
Yeah. And just something that I coach my patients on and would love your input into this because it's theoretical, but it makes some sense. Yeah. And there's Scandinavian studies on sauna, and on the podcast here, I've talked about sauna a lot.
Oh, yeah.
And I grew up with a sauna in my house. Did I use it? No, I was a kid. I was like, whatever. I was like, my parents are crazy having a sauna, but my stepmother was Finnish. So it was very common. In
Finland, sure.
So, but there's, there's big studies, European studies, 50,000 or more reduction in cardiovascular events, less cancer, et cetera. But I theoretically believe this, and I read some science studies on it, but, women don't like to sweat. Yeah. Meaning they go to the gym, they work out. I find this in just clinically, just anecdotally interviewing, they don't really like to. Men, we're pigs and we don't mind. Okay. So not just sauna, I'm just meaning in general. And it's such a big detoxifier.
Yes.
And they're putting on all these chemicals, cosmetics, topicals, et cetera, and exposed as we are too, but we tend to be sweaters more.
Yeah.
You know what I mean? And
absolutely.
I think that's powerful, meaning sauning a couple days a week could do wonders, or doing some type of exercise that you're, sweating off.
You're sweating, absolutely. Yeah, for sure. We know, you have to detoxify. So, your liver is got to be flowy, as I call it, right? So you want to support the phase 1, phase 2 detox. Your gut is phase 3 detox, as I call it. So you want to make sure you have a healthy gut for detoxing. Liver support, if you need be. Kidneys, another, drainage system, obviously, for detoxing. But absolutely, you want to sweat because that's the best form of detox, really. Or even if you don't want to sweat, take a detox bath. Like usually I'll recommend to the patients, put hydrogen peroxide, baking soda, lavender, and magnesium, like Epsom salt. So it's relaxing, but it's also a detoxifying bath, like baking soda, hydrogen peroxide, and put some 100% like organic essential oils like lavender oil or something calming, alpha, zen.
You've been in my house with my wife, haven't you?
Yeah.
The zen is happening.
Exactly. Well, God knows everybody needs a little more zen because the world is going nuts. Yeah. But absolutely, the saunas are important. But also you can't sweat because when you're pulling this stuff out, that's why you have to have a healthy gut too.
Absolutely.
And binders, glutathione, like something to bind all this crud that's coming out. You got to bind it, in some ways, or you liberate it and you get people sicker too.
Well, and thank you for saying that, because if there's a top 3 that I've seen for years in the practice coming from other practices and other practitioners, nothing, or people are doing this on their own.
Yeah.
Is I need a detox. I read I need a detox, a cleanse or whatever, and they do it on their own and they come in and report, I can't do that. I felt so horrible.
Yeah.
I got rashes. I got sicker. Maybe their autoimmunity flared, etc. They don't have a good gut.
Yeah.
And I'm like, yeah, you got to do step one, gut first, and then you can work on, detoxification.
You don't pull out, you let sleeping dogs lie, as I always say.
Yeah.
You let sleeping dog lie, and you only wake them up when the body is ready to take on the dogs, if you will.
Yeah.
So, we do that with heavy metal detox, right? I see this atrocities all the time, We're like, oh my God, the level is so high. I got to pull your mercury and lead or whatever, we're seeing. And I was like, oh my God, like you can't pull this stuff out when the systems have to be liberated and opened up. So when you're pulling the stuff, the body's able to handle it so you're not overwhelming the system and actually causing sometimes, we can cause liver damage and kidney damage and other things if you don't know how to do this, don't do this on your own. Yeah. And clinicians, you got to learn how to do this the right way because you have to be educated or you really can hurt people and make them much sicker.
Well, and then you create a fear in them about like something that they ultimately need. Yeah. And it's like, well, listen, if we just did good GI work and did gut health work first, they would be able to do it and support their systems.
1,000%, always... when in doubt, always start with the gut. That's what I always tease,
exactly.
And
what do we say in the
everybody's got bad guts.
Yeah, we said it all comes down to poop earlier, right?
Exactly, yeah. I mean, it's so true. When you really heal the gut, get it, if you really have people eat like an anti-inflammatory diet, clean and organic and lean and green as much as possible, grass-fed meats, pasture-raised eggs, kind of like homesteady stuff, right? Like the old days, instead of all the chemical, bombs that everybody's eating all day, right? Look at the colors, look at what you're eating, but even just swap to like basics, like they used to eat prior to the 1950s, right? Even when you eat healthy nowadays, they did studies, and actually the nutritional value of even foods today is 50% less than it was, a few decades ago. So even when you're eating healthy, you're still malnourished in some ways because even the healthy food is not as nutritionally it's not as dense with nutrition.
For sure. Yeah.
It's not as nutritionally dense as it used to be. So
and organic or not, meaning organic is just a whole other classification. It doesn't mean it's got better nutritional value.
It's cleaner, but it's not more nutrition dense like it was in the old days. So, always you want to eat lean, green, and clean as much as possible. Lower your stress. Try to sleep 8 hours a day. Drink water, logically to detoxify and keep things flowing. Optimize your vitamin D. Everybody probably needs B vitamins because everybody's stressed and they need it for enzymatic stuff. It's not just for stress, but also like minerals. What I find is so many people are deficient on just minerals, either, take a multivitamin, multi-mineral supplement or get like Baja Gold salt, as I call it. Put a little 1/4 teaspoon in water and just chug it first thing in the morning. Yeah. So you'll get 90 different minerals that we get in Baja salt and not the white iodized salt. That doesn't do that,
Absolutely.
So if you just put some of these basic pillars, and that goes for any disease, you start with those pillars.
You're going to start making traction.
And then we have a lot of other tools we can help you. Hormone replacement if needed. Certain peptides that obviously are still allowed and legalized, if you will.
We're going to talk about that.
Yeah.
I want to explore a little bit of that.
Yeah.
I'm glad you brought that up.
Yeah, exactly. We have a lot of tools, like there's tons of stem cell and research now, exosomes, saunas, cold plunges, photobiomodulation, red light therapy.
Yeah.
I mean, there's so many tools. You can't afford gizmos and gadgets, no problem. Just you can jump and get your lymphatics going. You don't need anything fancy. You can take a hot bath or a cold shower, right? You don't need to get a cold plunge bath, right? You can just do that. Cold shower, last minute of your shower, it's free. You know what I mean? Go out in the sun.
And it'll wake you up. Your dopamine will go up and you'll go.
Exactly. Go in the sun. Nobody goes outside anymore to see the sun, right? I mean, there's so many studies on morning sun exposure right before these light rays. I can't remember what they're called, but they're different than
wavelengths.
when it, just look at the sun.
Well, there's less blue light too.
Yeah.
In the wavelengths in the morning and evening.
Exactly. And in the evening, don't stay on your phones. Everybody's married to this technology and the blue light is just hitting them. Then everybody goes, I don't know why I can't sleep. Well, because you're not making any melatonin. Everybody's sleeping in pretty lit rooms with lots of electromagnetic frequency stuff all over, Wi-Fi. We're all frying our bodies all day long with Wi-Fi. So some of these things simple things that can really make a dramatic difference in people's lives,
So in something I want to get into just a little bit is peptides. And the reason is because obviously it's really in vogue right now. I got a couple of years ago peptide certified through A4M, and I know you're one of the the teachers in that program. And there's been a lot of changes, a lot of law issues, things like this. But I will say this, that it is definitely one of the most impactful things in my 15 years or 20 years in this space. So tell me what's going on with peptides and what are your thoughts and what do you think the future holds there?
Yeah. Well, we have lots of peptides that are FDA approved drugs, right? I mean, insulin is a peptide,
Correct,
right? So we have a lot of drugs that are in peptides.
Yeah, they're not that new, really.
Yeah, exactly. So they're not really new. Now, some of them, so with the FDA, there's in compounding, there's a list that, category 1, 2, and 3, if you will. So category 1 basically says that it's okay to compound them. Category 2 and 3 basically no. So we had definitely a lot of peptides that used to be on category 1, and compounding pharmacies were able to compound like CGC 1295, ipamorelin, and kisspeptin, some of these kind of hormone signaling, let's say, molecules, BPC 157, which is an amazing anti-inflammatory, right?
And great with the gut.
Exactly. TB, thymosin alpha-1, TB4, which is kind of immune modulators, if you will. So there's, LL37, an antimicrobial-ish, peptide, and so on. So they kind of went on the FDA do not compound list. So it's been difficult to get the typical peptides that some of the clinicians were trained on and were able to do. But there are absolutely, some of them are extremely effective. Now, I do think there's a lot of really amazing organizations working with the FDA to put them back on the list.
And there's some frags. There's some frags now, too, that
exactly.
I've used a bit. And we get pretty good results, like reasonable results. So they're just versions of like a, CJC, or, ipamorelin or one of those. And we get pretty good results.
Yeah.
You know what I mean? It's like very similar.
Yeah, exactly.
Because I'd rather use a good U.S. compounding pharmacy than something from China.
Exactly. Well, sometimes people are getting China, Russia, and honestly, like, I don't know what's in these,
Correct.
So
or nothing.
Exactly.
And you're paying a lot of money for nothing.
So you just have to be careful with those things, and absolutely, you always want to work with your, reputable compounding pharmacies because they really do it the right way. Follow the law, and obviously the FDA is here to protect people, right? So you want to work within the guidance of obviously regulations and things like that. But I do think there's a lot of people working with the FDA now to really relook at the evidence, relook at the science. And some of them I think will be joining or back on the list of the compound because absolutely some of them, like cerebral lysin for neurodegenerative is another one, right? They're literally life-changing and they make sense because look at what insulin did to humanity, right? With, with diabetes.
And even what's kind of happening right now with branded and compounded, the GLP-1s.
Yeah.
The Ozempic, semaglutide.
Exactly. So those are peptides, right? So, and there's about 200 other peptides actually in FDA approval pipelines, if you will, in different stages of studies and things like that. So peptides, like I said, it's not a new science. They've been around, insulin in the 1920s, I think came out, and but I do think some of these other signaling molecules for hormones or immune modulation, I do think we will see some of them back on the compounding list. Thank God.
Yeah, that's
because
good.
I think they were life-changing for
sure.
a lot of
very
patients.
life-changing, and we've had nothing but good to profound effects.
Yeah, exactly.
In many of them, and so it's definitely I think a needed tool.
And it's interesting, right? So you have like hormones, like hormone replacement therapy, like estrogen, testosterone, and so on. But also like when you give them a peptide, like a CGC, ipamorelin, for example, or like kisspeptin, it's like the signaling from the hypothalamus.
Mm-hmm.
Like, so you're almost going like a level or two
like
above
upstream
hormones, if you will.
I agree. Yeah.
To kind of help you naturally keep that machinery going, I guess.
Yeah.
You know?
No,
So,
absolutely. The growth hormone releasing peptides I have used very frequent and often in that down signal.
Yeah.
That upstream from the pituitary, hypothalamus and stuff downstream. It just seems within sometimes a month or two, even objectively in laboratories, things just get a lot better.
Yeah.
And kind of really support the
So
system.
they're interesting compounds, exactly. They're kind of like signaling molecules to help the body do its thing, and so versus I give you the hormone, it kind of helps your body keep producing your hormones, if you will, or growth hormone, or even the sex hormones, and exactly, vitamin G, I call the GLP-1s now. Vitamin G, everybody's on them, right?
Yeah, that's pretty good. I haven't heard that one, vitamin G.
Yeah, so I call them like vitamin G, exactly. So, everybody's on Ozempic or a Mounjaro or whatever, but that's what they're peptide, right? So they're GLP-1 agonists, and GLP is kind of one of those hormones in your body, again, like a peptide, a protein that says, hey, I'm going to slow down your gut motility. Mm-hmm. I'm going to tell your brain you're okay and not hungry and starving every 2 minutes.
Right.
And look at the amazing stuff we're seeing with addictive disorders now with these GLP-1s, right?
I frequently will use it in somebody that openly has a even drinking issue.
Yeah.
They're I don't want to. They're probably an alcoholic, but they're very functioning.
Yeah. High-level functioning alcoholics,
Yeah, exactly. And so the purpose of them is, and I microdose it, and the purpose of it is, I tell them, I think it's going to cut your craving. It's going to cut that drive. And it often does. And
what dose are you using for microdosing? You hear everybody's got their own protocol. I mean.
Very low. I mean, it's kind of personalized. It depends on weight a bit. Very often.
But you're starting like at one-ish?
Oh, yeah, 100%. Yeah. 1, 2 at most. And
it's amazing, right? That's the other thing. Like, please know, we don't always have to go to 15 milligrams, if you will, with Mounjaro. Not everybody needs that, And sometimes you get amazing results with 1 to 2 to 2.5 milligrams, or like the starting dose, and keep them on that.
That's what I do. I kind of usually at the starting dose, see how it goes, and we can tweak it up a bit.
Not everybody needs to go to the 7 and 10 and 15 and whatever, or Ozempic, obviously the 0.25.
And what I since we're on this topic, what I often find too, and this is the art and the clinical part, and I'm sure you've probably seen this, when I get somebody on a GLP-1 that loses 30 pounds, 50 pounds, whatever, and they're at a pretty high dose. I mean, 15 milligrams, et cetera, something like that. I'll back them down into like a kind of almost like a mid-level dosing, and they're like stable, and their diabetes or their very kind of borderline diabetes, insulin resistance, and all that is their A1Cs are like 4, 5. It's just and you don't need to do these big doses.
Yeah,
these huge doses, and then they get less side effects.
Yeah, again, it's just the art of personalization versus herd medicine, as I call it. Right? Those were the clinical trials, and absolutely, we need them for drug approval and to look for side effects and all that good stuff. But just know when you personalize, not everybody's going to need that dose. Some people will, but not everybody. And if they're doing greater than 2.5 or 5 milligrams and they're losing weight, their indices are good, their A1C is dropping, leave them there, and just let them ride and keep losing,
Right,
and keep building the muscles, because that's the problem, right? They lose so much muscle,
Right, and that's what we were talking about earlier. So key to keep muscle volume, hormonally, keep you active, keep that muscle volume, showing better brain function, brain volume, all that stuff. That's all very key. So before I wrap it up here, what's new in your world? What's going on with either A4M or you? You're always on the shake and the move. I always know this. Every 4 to 6 months, I'm talking. Well, I got something new I'm doing earlier. So what's happening?
Yeah, no, not really. Just mostly kind of lecturing, speaking. Me and my colleague were working on kind of a consumer book, if you will. My last book was Advanced Therapeutics and Pain Medicine, but it was really geared towards healthcare providers. So
I got to ask you about pain medicine.
Yeah, we're trying to put something for patients now. So we're working on a book, me and my colleague, Matt, who I wrote the book with, again, co-edited the book with, with the professional. And just, lecturing and curating the programs with A4M and, raising 2 cuties, and trotting the globe and teaching and lecturing. So
yeah. I always run into you somewhere, and it's like, Sahar, you're so exciting to see.
Yeah.
I love seeing you. My wife, like I said, says hi. She's like, you're the best. But so I got to bring this up because this is unique, and I get great results, and I'm sure you've heard of it. The Asian cobra venom for pain management, the topical and oral. Have you
Yeah.
used this or heard of it?
Yeah, I mean, I have not really used it much. I've definitely heard of it. You know, you'll see patients. I know. I always say you learn just as much from patients as we teach them,
Yeah,
right?
yeah.
You know, because it's always, you know, all through, because I've been in pain management for 27 years. You know, you're always like, I found this blue stuff from New Zealand, or I got this stuff from Australia and stuff. But yeah.
Well, Dr. Gann, Mitch Gann, and down in Florida, he kind of introduced it to me to a pharmacist down there, and I'm like, I'll give it a try or whatever, you know, and it's pretty amazing because the Asian cobra actually, I guess, it paralyzes the predator, doesn't kill him, you know, and so somehow with the tincture dosing and, you know, the liposomal like absorption and stuff like that, it really works like on the neural proprioception, you know, topically and orally. And so far, I've not seen anything really negative from anybody. And it's interesting because, like, you know, your bad back person, your bad knee, you know, the arthritic stuff. I mean, they're like, oh, that's great. I mean, it only lasts 6 hours or so, but it's natural and they get no side effect.
Yeah.
You know, so.
No, absolutely. I mean, you know, and it makes sense because, you know, when you look at venom, right, like even Asian cobra venom or any of those, you know, they're really working, you know, how do they paralyze the host, I guess, when they bite them or whatever you want to call it, when they paralyze you, because, you know, you're basically working in sodium channels, right? And sodium channelopathies, if you will. And we know those are involved in the pain pathway. So I think when we do disrupt that circuit, it's kind of like giving somebody a block, right? That's kind of what you're blocking is pain transmission signals and through these fast channels and sodium channels and stuff. So it would make sense, something that would, quote unquote, paralyze the person would paralyze these signals, if you will, from transmission and slow, fast signals, which are very specific, right, for pain. You know, they're fast signals.
I get a lot of big eyes when I tell patients what it is. I go, they're like, what? Like, what? And then, but
you want to paralyze me?
Well, they're like, you know, it's cobra venom. I'm going to either, because there's an oral version too, but usually I start with the topical and see how it goes. And it's pretty impressive.
Yeah, I have not really tried it. I've heard of it, you know, and many other things. You know, I've always had patients, you know, they'll always bring in their stuff or whatever, or, you know, text me or email and like, hey, what is this stuff? I got this stuff from like Europe or China or whatever they were, you know.
Yeah. So I have a segment here at the very end here where I call it my black book. And basically it's just kind of like a journal, kind of, a memoir, if you will, some science, some brain stuff, some studies and all that. And page, if you can't, because if you know, I'm a doctor, my writing's horrible. Go to something that looks interesting and we'll talk about it. Oh, do you need my glasses? Do these work? We'll see. Do those work enough?
Yes.
Do they work enough?
I was like, I took my glasses off.
So this part, the reason is this. I carry this. This is my third book, and it's basically, you know, it's some of it's science stuff I've read, interesting things, facts, mind-body connection stuff and that. And what I found is it sparks very interesting conversations.
Yeah. Okay, I'm kind of debating. I don't know why I'm like, okay, great longevity leader, coach. I like that. Or critical thinking does not happen in fear mode. Ooh, let's do critical thinking does not happen in fear mode.
Yeah. Which one? What is it? So it's, what does it say? It says, critical thinking. Yes.
Does not happen in fear mode.
Yeah.
You need your glasses back?
No. It's, that's just something that I will, I mean, I've talked about this on the show before with some counselors, psychologists here before. I think a lot of us make decisions and respond in reactivity and fear-based, and that's a normal human nature, you know? I think we just have to always be conscious of that.
Yeah, and also remember, your frontal lobes don't work when you're freaking out.
Right.
I always teach my kids this. Like, I'm always, like, drilling this into my kids and also telling them, like, you know, no drinking, no drugs, no smoking, no whatever. Because, you know, the parents have to be the kids' frontal lobes literally till they're 25. Because
they have none.
Yeah, well, because their frontal lobes are not developed really till they're 25. And this is just biology, like their neurobiology,
true. No, 100%.
Right? So, and the other thing I always teach, you know, my kids and everybody else too is when you are in this fight, or flight mode, stress mode, always on, the saber-tooth tiger, the saber-tooth tiger is chasing you. Literally, your executive thinking center is not working well because your reptilian brain is on, because it's trying to save you, because it goes, oh my God, you're going to die. Let me put you in the alert system, not the thinking system. Now you got to just save yourself. So the frontal lobes don't work well. And that really has to do with everything in life. When the frontal lobes, your logical thinking brain, whether, let's say, you go to the doctor and hear bad news, right? Like, oh my God, you have cancer or whatever. You're going to freak out, and rightfully so. But also I think, or, oh my God, you have, heart disease, you're on the verge of a heart attack, or, oh my God, something bad just happened in life. I think we all have, and also, let me back up one more thing before I tell you, hopefully, how to manage that. The problem is everybody's stressed 24/7, right? So like, we used to have on and off stress, but now everybody's like in this cortisol bath, as I call it, all day long. So I think a lot of us have lost like our critical thinking, logical skills, and just love for each other and humanity, right? Like, just be nice and kind, meditate, whatever your happy place is. You don't have to meditate if that's not your jam, but like twice a day, people have to like, zen.
Yeah, just stop.
Stop, like breathe, whatever that is for you. Like I take 4 deep breaths every time I'm at a stop sign or a red light. That's my rule, because that grounds me.
I love it.
Because, we go so fast, all of us. And then, when you're in this fight mode, when the kid triggers you, you're just going to be more triggered. When a spouse triggers you, even, your staff, your employees, your colleagues at work.
Yeah.
I think that's the problem. Like, everybody's so stressed. We've lost our critical thinking skills. We've lost our humanitarian connection somewhat. And if anything, COVID taught us is we need each other, right? Yeah. We gotta calm down. We gotta connect the dots again. We gotta put the logic back into the e-logic, as much as possible. And just really, like, it's a beautiful life. This too shall pass.
Oh, yeah.
When people are like, think it's the end of the world. And, the younger you are, everything you're going to think is the end of the world, but it's not. And the older you get, you're like, whatever, don't sweat the small stuff.
Exactly.
It's a great book. I don't know if you ever read that. Don't sweat the small stuff. And it's all small stuff, right? When you eventually.
Sure. In the big picture, it is,
So, I think like, even just, we get a lot of like, I teach in academia, right? And we have such bright people, brilliant kids, because, they're coming into these like kind of elite schools and things like that. But, God, there's no logic. Nobody thinks logically anymore or connect the dots. And, and everybody's looking at like, Uber Eats or Google Doc or, like nobody communicates or thinks or debates. Like, critical thinking skills, I think, are on the verge of extinction. And I think that's horrible for humanity.
It's horrible for society, for sure.
For humanity, literally. Like, if you tell me what's the biggest fear that I have for humanity, it's this, honestly.
Yeah, wow.
Really.
You picked a good one.
Yeah, yeah.
When I've always said and preached this, like, everything in life, I told my kids this all the time. It's, and they're adults and they're like, Dad, we're sick of you preaching. Yeah. But it's like, everything's based on love and fear. Yeah. Everything. Yeah. Every decision, every move, everywhere. Yeah. So are you doing it in love or are you doing it in fear? Yeah. And you're going to get critical thinking and you're going to get more logical thinking in a love mode, in a, thinking of others mode and humanity mode and all that. Yeah.
Absolutely. So, when like, when my kids are like, are just like, breathe 5 minutes out and then we'll discuss it, because I want the frontal lobes to be on, logically thinking. And it's just, if we all did that, and we taught our kids how to do this from an early age, so they're more proactive versus reactive society. Yeah. Look how much further we would get in life, right?
Oh, yeah. Yeah, amen. Love it. Well, Sahar, you're the best.
Yeah.
We're going to have to do
you.
this again,
Yes.
We didn't even get into much.
I know. Yeah, we could talk for hours. We could definitely do a Joe Rogan 4-hour podcast.
Yeah, exactly. Well, I appreciate you again.
Yeah,
thank you for
thank
taking
you
your
for
time and
having me.
coming and joining us and all your knowledge and experience. And I do thank you, and I'll say this even for other practitioners out there, because you lay the foundation. You've been very critical in helping so many of us and learn and continue to learn and all that. So you're loved a ton, and we appreciate you. So thank you for joining us again here on the Deep Six podcast, where we make a generational impact and really teach you how to enjoy life, get health span, and thrive. We'll see you again.